Welcome everyone, and thank you so much for joining. Today we're going to be looking at something that many of us struggle with when responding to feedback. Feedback that we get on Care Opinion, feedback in emails, complaints, concerns, and compliments, and specifically, how do we balance empathy with policy and processes? So sometimes we lean really heavily in our responses into empathy, but we might not explain what happened, and other times we explain policy really well, but the response might feel a bit cold or defensive. So my aim today is to give you a really simple framework that helps you do both. And we'll look at the structure of a response and discuss practical techniques for explaining policy. So we'll get stuck into it. So today we're going to be looking at, as I mentioned, the structure of a response that can balance both empathy and policy, exploring ways to explain policy, and learning really practical techniques for writing. And of course, we're going to be discussing real stories and real responses as well. So to explain this, I thought a really great, simple way to think of it is I don't know if you've heard of a feedback sandwich where you've got the compliment and the constructive feedback in the middle. It's something similar like that I've thought of, but something that we can call like a responding sandwich. And so the reason I thought of this is because a good response shouldn't just be policy, and it shouldn't just be emotion. The responding sandwich, it's really about balance, and we sort of need all elements and fillings to make a good response. So if we only give policy, the response can feel cold, and if we only give empathy, the person may still be left without answers. So when we combine empathy, explanation, and action, the response feels more complete. And so this is a structure we're going to build on throughout the session. And I know it might sound a bit silly, but bear with me because we'll get stuck into it. So first off, the bread, we won't touch on this too much, but it's not our main focus, but it is the opening and closing of a response, and it can shape the overall tone. So there isn't one right way to do this. We can be conversational, we can address them within the text, and of course we can address them traditionally like a letter. So I've got an example here where they've just sort of said, normally I'm at a loss for words, but you were very kind, and so it's a wonderful little bit there. We've also got using the username within the text itself. These are all great if the story is quite positive, and of course we've got the standard letter, the dear so and so and kind regards as well. Perfect. All right, so we're going to get stuck into the main part, which is really that empathy. Now, I think all of us here are probably quite empathetic people, and the reason why I call empathy the salad is because it's present throughout the response. It shouldn't just be in one section. But yeah, what is empathy? I'm sure we'll all know. But Merriam-Webster, it defines empathy as the action of understanding and experiencing the feelings, thoughts, and experience of another. So it's something that we definitely all have. But how do we involve this in our responses, and what does this look like in practice? Perfect. So one of the easiest ways to write empathetically is, of course, to imagine what the experience would have been like from the other person's perspective. This isn't new, and I'm sure, everyone sort of does this, but what you can think of is if somebody was left waiting, perhaps they felt forgotten. And if communication was poor, perhaps it made them feel anxious or confused. So we don't need to guess every emotion perfectly, but showing that we've considered that human impact can make a real big difference when it comes to responding. So we can also, when we respond, we can apologize without necessarily taking blame. And so we can say, I'm sorry that you experienced this. And I'll show you how some responses achieve this. But yeah, as we said, imagine what it would have been like for them and talk into this. And you can say, I noticed that you felt scared, or, I noticed that you mentioned how you were feeling anxious, because that's a sign of active listening as well. And moves to the next point. You want them to feel like you have really listened to it all. So here's a wonderful response. And we can see that they've said, I'm truly sorry for what you're experiencing. No patient should feel dismissed, rushed, or unheard. And then they continue, I can understand why you felt, there was no point. So they've really, without reading the story, we can already see what the story contained. And I think that's a really good indication of a response. If it's showing those signs of active listening and empathy, can we sort of get a general sense of the story? And here we can even do it in positive stories. This was for a criticality zero story. And the responder has said, caring for a family member who is unwell can be incredibly challenging. So we're practicing that empathy even in positive stories. It doesn't just have to be reserved for negative stories. Now, this is the tricky bit. How do we balance this then with policy and processes? So, there can be a temptation to avoid explaining policy because we're worried it's going to sound defensive or bureaucratic. But in reality, and I firmly believe that explaining policy is actually a very empathetic thing to do. And I'll go into why. But explaining policy is not just empathy is not just expressing emotion. It is also communicating understanding of how a policy affects the person. So a healthcare response can explain rules, eligibility requirements, clinical policies, while still acknowledging the patient's situation. So I might just click through here. In our responses, we can say what should have happened. We can say that, this should have occurred in your care, and this is our policy. Because when we explain policy clearly, we're actually treating the patient as equals. We're giving them access to the same information that informed the decision. So rather than saying, this is the rule, we're actually helping the patient understand how the process works and how it applied in their situation. So the goal is to be both accurate about the policy and responsive to the human impact of the policy. So that's how we can really balance that empathy and policy is that they're both interlinked, I would say. So we can use it as this educational opportunity. And of course we can, it could be as simple as explaining triage scores. So I have a couple of examples here. Of course, we've got in this example, Katrina's saying, it's a pregnancy story, and she's come out and said, these options should have been discussed with you. This is our policy, is essentially what she's saying. And she's educating the public when she says that. We also have a response here. It was for, Fiona Stanley. It was about staff smoking. And as you can see, it's a very long response, and it goes into all the changes that are being implemented. And when we have a response that goes into this level of detail, what we're doing is we're treating the patient like an equal. We're showing them that we have listened to them, and we're explaining the policy with the patient as if they were a participant in this decision-making process, rather than just someone who is simply being managed. Great. We've also got, another response, and we can see here, it says, the current wax management guidelines, for COVID-19. So, it talks into this policy as well, and treats the patient as if they're, very much involved in their care, which of course they are. And I have another example here where I've bolded that section that says, your discharge summary should have been provided to you upon discharge. So it's really educating the public about what they should expect, and it's really settling these expectations whilst being empathetic as well. So we have the empathy, we have the policy, and in a response that is empathetic and explains policy, it's also important to explain what we're going to do. So that's quite important if we're doing both those things. So simply explaining policy can treat someone as an equal by giving them access to the reasoning behind a decision, but explaining what we're going to do further, it demonstrates that the person is not being left alone with the policy. So it turns something that was informational into something that was quite collaborative. So we're effectively saying that, you know, I've listened, I've explained, and here's how I'm going to act on what you've told me. So we can even do this with positive stories, and you know, all feedback should lead to some action. So I think it is important in responses that we can say something like, you know, I'm sorry that this happened to you. This is why. This is what I'm going to do with this. I'm going to discuss this in a team meeting, or I'm going to use it for X, Y, Z. You know, feel free to go into detail about what this feedback has led to. And I'm going to show a really great response that does this in the next slide. But here, this is how we can do it in lovely positive feedback. So even positive feedback should lead to somewhere. Perhaps it will be, you know, shared with the team, discussed in a meeting, used in training. As we can see here, Katrina's passed it on to Hillary, and she's explained, you know, that conversation with Dr. Hillary. And, you know, here's another positive feedback about what they're going to be doing with that positive story. And here again, this was for a crit 1 story, so just about the food. So, you know, nothing major that could be done, but even just saying I'm going to be talking to the staff about it makes such a difference. This is a really great response. So this was for, you know, an emergency waiting time. And as you can see, Chloe has gone into such depth about what she's going to be doing with this feedback. So this feedback has actually driven to them looking at their data and having a look into reviewing, you know, some of their processes. And she's gone into such fantastic detail there. So again, with Katrina, you know, showing that, you know, the feedback that she's, you know, discussed with the staff member who the story is actually about, which I think is quite powerful. So yeah, there's lots of ways that we can show the action that's happening to feedback, and that absolutely links to empathy and to that explanation of policy, because you really can't have one without the other. So to sort of finish up on the presentation side of things, I just want to show you an example of what it can look like all together, and then we'll stop the recording and get into a discussion. So we have this story here, and basically, because we don't have time to read it all, but the patient was directed to call an ambulance by the hospital. And in the story, they say they were quite cold and they weren't given the blanket by the ambulance team. And then they also say that they felt really uncared for, and they felt they weren't taken seriously due to their disability, and they, you know, wanted follow-up tests, and that didn't happen, and they felt that it was because they had, you know, chronic illness and they weren't taken seriously. So when it was responded to, it was quite a good response. So I thought I'd break down using the salad analogy to really show what they did. So we can see here the empathy, and we can see it throughout, but especially at the start. I'm truly sorry to hear about your experience. More empathy, repeating what happened, you know, repeating what you read. Your encounter with the nurse further compounded your negative experience. And we can also see, you know, talking into what they brought up and recognizing what they said. So that's all the empathy. That's a lot, you know. But the response continues on the next slide. We've also got the policy and process. So, you know, patients should be treated as individuals. You know, follow-up tests could have provided more insights, and you can really talk into here what patients should expect. And you can think of yourself as if you're talking to the public. You know, what should the public be expecting when they come to your health service? And then, of course, you know, she's included what they're going to do. So, you know, if you contact us, what are we gonna do about that? And I haven't mentioned it, but I have just added it because no one likes the lettuce. But no, we can also have the contact details, which I didn't think we needed to explain, as yeah, it's included in almost every response. But yes, we absolutely have those contact details in there. So to summarize, when having policies that really balance empathy and policy process, with the right amount of empathy and the right amount of care, explaining your policies is very much a practice of empathy, and it is a very much empathetic way to respond. It shows, equality in decision making with your patients as well. But you absolutely need to include, what you're going to do with your feedback, because that holds it all together. Wonderful. So I'm going to stop this recording now so we can have a bit of a chat.